Thank you for being here. I've been very impressed with what I have seen here. The Acting Minister of Health, Minister Kubai, and the Premier and the MEC have been showing me around. And we are making a great deal of progress. The numbers of vaccinations are ticking up. And one of the things I had come to check is whether they have any shortages of vaccines. They told me that they don't have shortages. They've never had shortages. But today is a bit of a slow day. And on a good day, they do manage to vaccinate quite a lot of people. And the Premier Makura, was telling me that he has directed that vaccination centers here in Gauteng must double their numbers because we have so many people who still need to be vaccinated. And the Minister is going to make sure that there's good supply. We now have a much more confirmed good supply of vaccines. We're not going to run short of vaccines. We're bringing in quite a lot of innovation in the vaccination process. And the Minister was telling me that one of the innovations is drive-through vaccinations, where people just come, stay in their cars, and they're vaccinated, the screening happens, and then they move on. So this is a new innovation. I think it must be one of the few firsts in the world. And we keep looking for ways and means in which we can improve to increase the vaccination levels. And the other good thing, of course, is our cooperation with the private sector. After this, we are going to go to a private public vaccination center, which is essentially also being run by the private sector in partnership with us. This one is more public sector. So the partnership is helping us a great deal also to up the numbers. So we're pulling out all stops. We want to have reached a very good number of people who are vaccinated by the end of the year. And I think we are in line in doing so. So with 7 million people or so who have now been vaccinated in our country, we should be heading towards a population immunity soon. So I'm very happy with the way the vaccination process is going. Of course, the good and better news is that we've now positioned ourselves as a country, also as a continent, and us, South Africa, acting also on behalf of the continent, to be the hub for the manufacturing of vaccines, so that we can move away from fill and finish. We will in time be able to have the drug substance manufactured here, and it will be filled and finished here and in other centers on our continent as well. So COVID-19, much as it has been quite a devastating pandemic for all of us on the continent and in our country, has enabled innovative and creative ways of addressing this and future pandemics a lot more effectively and more efficiently. So in other words, and as far as the vaccination doing it effectively, it's been a wake-up call. And now the continent has woken up that we must be in charge of our own health destiny. And that's what we are aspiring to do. And as I've been appointed the COVID-19 champion on the continent, that's precisely what we are working on. So it's a good story. It's a wonderful, evolving good story as we move forward. So we feeling our way on the stones as we cross this pandemic river. Thank you very much.
Mr. President, just a quick one from Newsroom Africa here. Just a quick one. The question now is, tourism has had a significant impact. and as much as health needing many, I would say, all hands on board. Are you looking into reconfiguring your cabinet to ensure you have permanent portfolio managers?
Well, the issue of reconfiguring a cabinet is an ongoing consideration by any president. You look at how you deploy the people who you are working with and how you place those people to execute various tasks. So it is an ongoing process of evaluation and all that. So it's not something that we would say it's a process that is outlandish. We continue to look at it.
Mr. President, thank you. CD Madia from Eyewitness News. So, Mr. President, you're saying to us that a cabinet reshuffle, the firing of some ministers, including the security cluster that did it through a national crisis, is not a priority at the moment. The country says reshuffle your cabinet, never mind just moving them around. It says fire particular ministers. Are you saying that's not the priority? It's not time to get rid of them?
What are you trying to get me to say? That I'm going to fire ministers and all that?
They say many should be gone, saying some members of cabinet should be gone.
As I said, the process of people who are deployed to work with any leader even in a cabinet process, situation rather, it's a process that you evaluate, and it's best to leave it there, because
is it not time, Mr. President?
It's best to leave it there, and it's a process that one does as one evaluates everything and everyone that you work with.
No more questions.
President, Maseko from ENCA, Mr. President. I just wanted to ask you, looking at the numbers that we received from the health department yesterday, with more people getting tested, it looks like we didn't actually get over the third wave, and that it was probably irresponsible to tell the citizens that we did, because during those 2 weeks people weren't getting tested because they couldn't get access to those testing stations.
Well, I don't think one could say that it was irresponsible. What we have observed is that there was a dip, and the dip was confirmed by our medical advisory people. So they confirmed it, and we act, and the minister acts here on that advice, and the National Coronavirus Command Council acts on that. Now, obviously, we are dealing with a very fluid type of pandemic, goes up and down, and we did say that we are in other provinces we are seeing a rise in infections. Now, we've given ourselves and communicated very clearly to the country that every 2 weeks we're going to evaluate the situation, and we will be able to address and communicate to the country what we are seeing. And if indeed we are seeing a rise again, we have to adjust, because we are dealing with an evolving type of pandemic. So I would never say that it was irresponsible. It is a matter that we are managing daily. And the good thing, though, is that we are managing it in a very transparent manner. South Africans want to know what we are doing, and that's precisely what we are doing. We are communicating, and yesterday we saw the figures having gone up, and we will observe that today again. And if indeed we see that they are going up and up, then the National Coronavirus Command Council will evaluate the report, and the minister will also take the advice and advise the council, and then we take decisions.
Thank you, Mr. President. Two more. It's Diado from Power FM. President, it looks like more people are now coming out to vaccinate.
Yes.
But we've got a shortage, well, not a shortage. Are you not worried, though, that the number of vaccines versus the demand may get to a point where you've got more people wanting to vaccinate, especially going into the younger age group, and not having sufficient supply of vaccines?
No, as I said, even when I addressed the nation on Sunday, we now have a situation where vaccine shortage is no longer going to be our problem. because we've got the vaccines that we have ordered coming through, and obviously the 31 million does not come all in one day. So sometimes there will be, a bit of a stop for a day or so, but it's no longer the drought of vaccines. We now have a good supply of vaccines. Today or day after, we are going to receive 5.7 million that have been donated by the government of the United States. And Aspen at Gqeberha is going to now start delivering, producing vaccines for us and the rest of the continent. So I'm not worried. Earlier I was worried, and that's why we entered into various negotiations with pharmaceutical companies as well, various governments in the more developed economy part of the world. So I'm not worried. Shortage, there may be shortage in one center for a few hours a day, but we will be able to fill that gap.
Our last question over here,
Mr. President, we've had the SIU report that you gave for the past month and a half. When are you firing the visa or taking action? 2, did you speak to former President Jacob Zuma before you went to hand himself here at the Export Correctional Services facility? 3, what is South Africa's response to Israel being given observer status as the African Union?
No, I did not speak to former President Jacob Zuma before he handed himself over. We regarded that as a process that must be handled in the normal course. So there was really no need for that. And in any event, I am able to speak to former President Jacob Zuma anytime and in any way, but the occasion never presented itself then, and it didn't happen. I've received the SIU report. There's still some finalization of certain aspects which we're going to get. So I'm looking at it and I'm studying it. So allow me the time and the space to look at that. With regards to the admission of Israel as an observer at the AU, we've expressed our deep concern about that because it's a decision that was taken by the chair of the commission and without consulting the member states. Certainly we were not consulted. We have views because we are concerned about what is happening in Palestine. The continued situation there in Palestine, in our view, militates against just warmly accepting Israel as an observer in Africa, particularly in view of the positions and the views that we have taken ourselves as a country against the state of Israel on this issue. So we are opposed to their admission. We are concerned about the decision that has been made. And as it is now, a number of countries on the continent are expressing their unhappiness and dissatisfaction.
Mr. President, one final question. Last week, the deal between BioNTech and Pfizer was announced, and they are saying that the vaccines that will be locally manufactured will only be available in the third quarter of 2022.
Yes.
Would you say that it was quick for us to celebrate the deal when the vaccines will not be available as soon as they might be required to be?
No. We welcome the deal, and obviously BioVac has to prepare itself. You don't just manufacture vaccines so easily. You've got to set up processes. People have to be trained. Easily up to 400 people or so have to be specially trained to be able to handle all this. So this all takes time. What we celebrate is that finally we do now have we will have a center in South Africa, 2 centers, where we'll be able to have manufacturing capacity for vaccines. Now, we now live in a world where pandemics are going to be occurring on an ongoing basis. So that center will be ready to do the COVID-19 vaccines, and other vaccines as well. So that is the beauty about that deal, and it's a wonderful deal which we should welcome, because it places South Africa in a very, very good position in as far as being the center of vaccines manufacturing. Thank you very much. Thank you. Thank you.
That's the President of the Republic, President Cyril Ramaphosa, giving us that particular indication that there is a sharp
oversight. And just to summarize, in these oversight visits, you only get the good information on the Q&A sessions. But just to give you a summary, he wouldn't be drawn on whether there's going to be a cabinet reshuffle. And he's very confident that we will have a steady supply of vaccines, that we certainly won't run out. And I thought quite interesting that he didn't contact the former President Jacob Zuma before he went into jail. Next.